Most people don't realize if you have a disease, it's rare. And the reason why it's rare is your genetics and your microbiome produce a set of interactions that have never been seen before in history. So it doesn't matter if you had a label like prostate cancer, and millions of guys had prostate cancer before you. None of those guys had your genetics or your microbiome.
Welcome to the Exercise is Health podcast, where we're talking about exercise, health, and the interconnectedness of the two. We are your hosts, Charlie
and Julie,
and we will be coming to you every single week from our studio, Muscle Activation Schaumburg. Hey, welcome back, everybody, to the Exercise is Health podcast. We are your hosts, Charlie
and Julie,
and we are coming to you from our studio, Muscle Activation Schaumburg in Schaumburg, Illinois. Now, at Muscle Activation Schaumburg, we believe your health is your most valuable asset. Your health is one of the biggest influencers of the quality and quantity of time that you have. And while there are many aspects of health, our expertise is exercise. Exercise has been proven time and again to not only improve your health, but also increase your longevity and improve your quality of life. And because exercise is such a strong piece of the puzzle, we are bringing you a rock star expert on exercise as well today, none other than Dr. Tom Incledon. Dr. Tom Incledon is a world-renowned expert in human health and performance, is the founder and chief scientific officer of Causenta Wellness, where he's bringing a unique approach to healthcare and cancer treatment that's never been done before. Throughout his career, Dr. Tom has revolutionized the way over 40,000 people have achieved their health and performance goals, and he's seen it all. With Causenta, he's pioneering a new data-based approach to cancer treatment that combines traditional and non-conventional practices. Dr. Tom, thank you so much for joining us and welcome to our show.
Oh, thank you for that wonderful intro. I feel like I might actually be someone that knows something.
No, we are really, really excited to talk with you. You know, we heard your episode that you did on Renegade Radio, and that was really cool. And so, you know, we want to find out more about you, about, Causenta Wellness, what you're doing now. But why don't you start us off kind of bringing us through your history of how you got into medicine, how you got into exercise, how you got into cancer treatment in the first place?
Sure. So I grew up really poor, had a babysitter that I had a crush on. I was, maybe 7 or 8 years old. She was 16, and, the most beautiful woman in the world. And one day she didn't show up. And, I was talking, it was kind of like I talked to her on a Tuesday, and a Wednesday, never saw her again.
Wow.
And I come to find out she had a brain tumor, and she was gone. And so, at that point, I really didn't know what cancer was. Also, at that point in history, hardly anybody had cancer. Like you would never hear of it. I mean, compare that to today, where everybody knows somebody that has cancer. It's just a crazy explosion.
Yeah.
And so you might say that planted some seeds. And then later on, I was, we're fast forwarding now, maybe 20-ish years, give or take. And I was training for the Olympics and weightlifting. I was born crazy strong. I could lift all kinds of heavy things, but I wasn't very flexible. So while I was training for Olympic weightlifting, I went to a barbecue, and at the barbecue, I got really sick, and I probably got some food poisoning. And I wound up going through this experience where I went to a hospital 3 times. First time, I lost 10 pounds. Wow. I go to the hospital, and they check my blood pressure and my heart rate, and they go, everything's fine. And I'm like, the problem's not my blood pressure and my heart rate. They tell me I'm okay, but I'm still, I had chronic diarrhea. I'm losing water like crazy out of my body, and they're checking my pulse. So the second time, I now lost another 10. So this is like day 1, I'm 10 pounds lighter. Day 2, I'm 20 pounds lighter total.
Whoa.
And the same thing, they're checking my blood pressure and heart rate, everything's fine. Well, the third day, I lost consciousness. And so now I'm in an ambulance, I'm unconscious because I lost another 5 pounds. I lost almost between 25 and 30 pounds in 3 days.
Whoa.
So my blood pressure now is, of course, very low because I have no blood left in my body. Sure. And so when I'm in an ambulance, I'm at the hospital, they go, your blood pressure is low. I'm like, that's because I've lost all this fluid, and you guys didn't do anything about it. And so now they run all these tests, and the tests come back negative. So I asked a logical question, what did you test for? And they couldn't tell me. So I'm like, well, if you don't know what you did, how do you know it was actually done?
Right.
And these are just really logical questions. And yeah, I went through an experience where I realized that, what determines the decisions in healthcare are based on time management. They're based on fear of litigation, liability. It is nothing to do with optimal biology actually helping the person in front of you. So I asked for a doctor to prescribe some sort of broad spectrum antimicrobial agent because I felt like I had something swimming around in me like a parasite. All their tests were coming back negative, and I just, I was an elite level athlete. I knew my body felt. I just knew something was wrong, but I didn't have the precise detail to say, hey, this was a blastocystis hominis infection inside my body,
Right.
And so I winded up then. The first doc says, no, I don't want to prescribe anything because I don't want you to get antibiotic resistance. I'm like, I'm dying right now, and you're worried about a theory for 10 years from now. So I didn't agree with his logic, so I asked for another doctor. Next doc comes in and says, sure, writes a prescription for me, and like 2 hours later, I'm perfectly fine. So I had to go through this whole ordeal just to get one med, and then I thought, wow, this is ridiculous. So at that point, I was an undergraduate, and I certainly didn't have the training and preparation that I do today. So I just saw there's a lot of opportunities to improve healthcare. And then shortly after that, I just saw that we were doing a collaboration with UC Berkeley. So I was at Penn State University, and at the time, Penn State was known worldwide for their research in exercise science, strength training, and hormones, and all these different things to do with exercise physiology. And UC Berkeley was world renowned for their knowledge with cardiovascular medicine and risk factors. So we were involved in a collaboration where we collect some samples and send some blood samples to UC Berkeley. And one day, someone walked in and said, hey, do you guys do the Berkeley heart test? And I'm like, yeah, we do it. But the other doctor's like, no, we don't. And I'm like, what do you mean we don't? And they said, well, we have this research project with them, but we don't really have a way commercially. Like if you came in and said, I want to buy something, it would kind of be like if you were at Walmart and someone says, well, I want something from Sears. You really can't do that. And that's kind of what it came down to. So I saw this opportunity to basically connect all these labs. And so we get kits now from every lab that has some unique sort of test. And now you could kind of one place, we draw the blood for all the different labs, and now we could send your blood specimens anywhere. Well, we started doing that in 1989. So we created just an amazing awareness and understanding of how to measure different things in the human body. And it was the best experts involved. So as an example, today we use a lab that involves Harvard and Stanford scientists and guys from MIT. So if we have questions, the resources we have available, I could talk to a guy that's got 2 MDs from different countries and 3 PhDs. So they could provide resources that most people, they would never see someone at that level because they're usually locked away in a dark room, get called a lab, and they don't see the sun and all that kind of stuff. And I know this well because that's what most of my career was spent, isolated from the rest of humanity. And so today, this sort of foundation, if you will, I was able to study under some very bright minds, and I was an extremely competitive person. And I sort of I took the approach that the same way I compete in sports to win, I had no interest in competing for a silver or bronze medal. I wanted a gold, or I wanted first place. And I brought a lot of that to taking care of patients. And so today we have patients come from around the world, and we essentially, what I did is I took a model from athletics and I applied that to disease. Here we have outstanding physical therapists, works at Olympic teams. We have a naturopathic doctor that has trained hundreds of thousands of doctors around the world. We have a medical oncologist that's maybe seen 100,000 patients in the largest centers all over North America. Wow. And the list goes on, and all the different professionals that we have. So I've sort of created like the super friends, if you will, in healthcare. So I got all these bright minds, and I teach them how to work as a team without killing each other,
sure.
Because that's sometimes hard. You got very bright people, and sometimes, it's always a little bit challenging. But the results speak for themselves. I can't tell you how many people have come here in wheelchairs because they were too frail and had cancer all over their bodies, and they leave looking like supermodels and gaining 40 pounds of muscle. People often ask what we do, and we say everything. there's no stone we won't, look under, and there's no test we won't do to help someone. The difference is that this is not a one-man band, and when we say integrated, we really have lots of professionals. As an example, the patients here that are undergoing treatment for cancer, they have a strength coach.
Oh, interesting.
And when I talk to patients in other places, they say, "Well, I have to get stronger." So I go, "Well, who's in charge of that?"
Right.
I go to my doctor. I'm like, there's no way you're going to take a chemo drug or radiation and get stronger. Like, something's backwards there.
Yeah.
Even an IV, you can't put vitamin C in a guy and the contractile strength of his arms increases. This is illogical.
Right.
What happens is people don't know physiology very well. They think, well, I do this, I kill the cancer, and magically my life will get better. But was a glaring weakness in understanding of disease. And this is where my background as lead athlete in 5 sports really brings us to like the forefront. If you watch any athlete, that male or female athlete in the best shape of their lives, they have a knee injury, one leg, one joint, one injury, and they can't use that leg. And in a series of days, you can see a difference in the muscle mass from the injured joint, injured leg, and the healthy leg. It's weaker, it looks flabbier, fatter, whatever you want to say, but it's clearly dysfunctional. There's no disease process. That's just an injury in a healthy body. Now take someone that's got cancer all over their body that's not moving because they're lying in bed. What do you think would happen to them? Right. They go downhill
even
faster.
Worse. Yeah.
So it's been shown over and over again that lack of movement is almost as bad as the disease itself. Yet what you hear all the time is, "Oh, you need to lay down and rest, honey, so you don't wear yourself out."
Right.
And everybody's so nurturing that they forget that you're not beating a deadly disease like cancer by taking a day off, right? Cancer doesn't take holidays, has no mercy, doesn't care how old you are, what color you are, what your gender is. And so you need a program that has that same level of intensity and effort to fight something like that.
Wow.
So I hope that gave you a little bit of background about us.
Yeah, that's amazing. So there's so much to unpack there. I guess my first question is at your clinic, do you predominantly work with cancer patients, or is it a broader spectrum than that?
So let me answer that in maybe 2 ways. So the clinic itself will take care of anyone that walks through the door. And we basically, you could think of it as a one-stop shop for healthcare. We do not do major surgery. We do not do, intravenous chemotherapy. We do not do radiation. There's just very large centers that have expertise for those things right around, nearby. So there's not really a need for us to do that. You could say we do everything else, if you will. In terms of me personally, I like taking on very challenging, intellectually stimulating cases. So I deal almost exclusively with rare cases because most people don't realize if you have a disease, it's rare. And the reason why it's rare is your genetics and your microbiome produce a set of interactions that have never been seen before in history. So it doesn't matter if you had a label like prostate cancer and millions of guys had prostate cancer before you. None of those guys had your genetics or your microbiome.
Sure.
And the mathematics of this is such that we have about 22,000 genes. No matter how you look at those interactions, that doesn't explain over the course of history, we have roughly 50 or 60 billion people. How do you get 22,000 into 60 billion? Like, there's got to be something else in there.
Right.
So what people don't realize is, like, let's say you eat something as simple as an orange. Not a big deal. Except that no 2 people respond the same way to eating food. And that's way less complicated than studying cancer biology.
Sure.
And what's kind of missed is that most of our biomass is not human cells, it's actually other organisms, if you will. And a single organism like Lactobacillus rhamnosus GG, that can influence over 100 of our genes.
Wow.
Well, now, when you sort of, reconcile this data, we have more cells that are non-human in our body than our human cells. And those other cells have such an impact that one of those organisms can influence over 100 genes. How are we going to predict what's going to happen, right? We just don't have enough info. And I don't believe in conspiracy theories or things like that, but when you look at the trillions of dollars raised for cancer research, there's some glaring questions that have never been answered. How is it to this day we don't have real-time analytics that tell us? So, for example, let's say you had a superficial skin tumor. There's nothing available right now where I can inject in a tumor and see, do the cancer cells in that tumor take up the substance? With all the research that says, oh, we're going to cure cancer, all these knuckleheads that say we're going to cure cancer, why is there such little results? And the reason is it was a facade. The funding is designed to provide evidence to stimulate more sales. It has nothing to do with optimal biology.
Interesting.
Optimal biology has accountability. And one of the first things you'd want then is a precise way to measure something. There's no perfect cancer test, right? So, like in theory, you would say everyone produces cancer cells, and then we have specialized immune cells like our natural killer cells that go and kill the cancer cells. Great. Now find one human being in history that you uncovered a cancer cell without a diagnosis of cancer already.
That's
It's
true.
never happened, right?
Yeah.
This is all theoretical. So we have these ideas, but there's actually no actual proof because there was no way to make money from them. So there is the ability today to do single cell analysis of cancer cells, but there's no way to find all those cancer cells in your body. So let's say you had a cancer cell, right in your skull versus one in your blood. How are you going to know where to look, right? There's no precise instrument. Even things like PET scans, which use a radiolabeled glucose, that's an outdated technology, but that's what's used worldwide as a quote-unquote gold standard, because the idea is cancer cells are more metabolically active and you can take up the glucose and then see what's going on. What's lost in that is how many things impact the glucose uptake of cancer cells. Anyone that's more competent would have said, why didn't we use radiolabeled thymidine? Because that involves DNA synthesis, not glucose uptake. Now, if you call any imaging center, they will ask, when you go, hey, do you guys have a PET scan that uses radiolabeled thymidine? They will go, what? They don't even know it exists because there's no reason to change yet because they still have to get the return on their investment for buying the PET scans they have already.
Yeah.
Interesting.
So, Dr. Tom, you've mentioned some different specialties that you have at your facility or have access to. What are some? Whether you want to list them all, I'm sure they could go on and on. But what are the common specialties that someone that might visit your office for cancer treatment? What are they, dabbling in? I know you mentioned physical therapy, and I know you mentioned a strength coach. What other specialties are included in that?
Well, so neurology, we look at the brain and the rest of the nervous system a little differently. So let's say if you went to a hospital and you saw a neurologist is going to say, hey, you got this problem, and my solution is drugs or surgery. Here, we're going to evaluate you, and then we'll say, we think we could treat this through exercise or through movement. And what we do is we put the body in challenging situations for balance. So let's say as if your feet on a tightrope or like a gymnastics balance beam or something like that. And then we put a load diagonally across the body. So we have an unbalanced loading while we force you in this awkward position to maintain balance. And while you're doing that, we have you doing a precise motion with your shoulders. You do like a shoulder circle or something. And so it involves a lot of, let's say, neurological real estate. And as you get through these movements, people are like, wow, I move better now. And so it's interesting is a lot of people say they feel more athletic. And what's really happening is we're improving internal body awareness and the ability of the brain to map to different parts of their body. So a good practical example is you ever walk and trip and you look behind you and there's nothing there and you're like, how did I trip over that? And essentially what's happened is your brain thinks your foot is in this position in space and it was simply in a different position in space. And one of the interesting things is when I have people close their eyes and do something like a hip circle. So essentially imagine they're standing upright, they extend one leg behind them, so it's not touching the ground, so they're staying on one leg and they're kind of moving their hip in a circle. I say, all right, tell me what you're picturing right now. And many people are picturing their ankle. They're moving
interesting.
their hip. So mind's eye should be inside of their hip joint,
Right.
but they're focusing on their ankle, in other words, the extremity. And it sounds like, oh, no big deal. But think of it this way: if you don't know what part of your body you're controlling, and you can't visually see that, it's not going to be as precise as you think. And then there's things like you could do these sensory discrimination tests where, like, something as simple as are you guys familiar with dead bugs or those types of movement
Yes.
patterns?
Yes.
So imagine someone's in a dead bug position. So, their arms and legs are up in the air and they're drawn in the core. Now, and we just tell them what to move. One, you see how they process things. So let's say they're supposed to move, left leg and right hand go down and then come back up. So we give them cue words and we see how they respond. Then we have them close their eyes, and the same thing. And you see they get all discombobulated. They move the wrong limbs.
Interesting.
Because without visual feedback, you remove visual bias, and now you see what's their ability of their brain to control their body. And we could do other things. We could have different sounds playing while they're moving. And the reason why this stuff matters, it's sometimes a lot of people with cancer would say, why are you working on my brain? And if it was someone that I knew really well, and let's say I'm not worried about hurting their feelings, I would say, one, because you don't know how to control your body. And if we were at dinner having a social, evening or something, if you ask any person, regardless of their medical background, what controls everything in the body, almost everybody would say the brain. There's not too much controversy over that. Now I want you to go to any cancer treatment center in the world. Outside of if someone has a brain cancer or something like Alzheimer's or Parkinson's, ask them what they do for those patients for their brain, and it's nothing. So a major source of control of the body is ignored. And now let's kind of jump ahead to other areas. There's more contemporary concepts called psychoneuroimmunoendocrinology, which is a fancy way of saying everything's connected.
Okay.
We have things like physiological crosstalk, which means that different systems actually talk to each other. Like we can send signals down our bones, which you don't usually hear about. And there's concepts like chemical mimicry. So we used to call certain substances neurotransmitters. Now we know that's just a bold-faced lie because we don't know where those substances came from. So as an example, you measure dopamine. It could come from a neuron in your brain. It could come from a different part of your adrenal glands. It could come from your kidneys. Now, how are you going to call a neurotransmitter if it came from your kidneys or your adrenal glands? So we know today that we have to refresh our understanding and our terminology. And now we call so many substances biogenic amines. But what that means now is when we measure something in the blood and it's low, why is it low? Like there's three possible scenarios, right? It's different tissues that it could be low, or let's say if it was high and stuff like that. And it's those little details that make a big difference in outcomes later on.
Sure.
So I realize there was only one specialty I talked about, but it kind of gives you a sense at the depth that we have for all the specialties. I usually get hit up a lot of times. People go, especially older women that are frail and say in a wheelchair, and they're coming in and they go, honey, I don't need a strength coach. And, I'm like, well, but you can't stand. Who's going to help you get strong enough to stand? And a lot of times you'll be resistant. They're like, well, I'm old and, I've been weak for years. So why would I expect to stand now? And my answer is, well, because your expectations are to get better. Your expectations are never to settle. And I'm not settling. I'm throwing out your wheelchair tomorrow, so you don't have that as a choice anymore.
Gotta
right?
keep going.
So
There you go.
we had this joke that had this woman come in, and she came here, and she looked, we got her in really good shape. And she was an older woman. And she went away, and her husband were trying to sell. They actually sold property in California to move back to Arizona so they could come here more often. And the transition took longer than they expected. So when she came back, she was in a wheelchair. And I saw her, and she looked really rough shape. And I said, look, this is the last time you'll be using this wheelchair because I'm throwing it out.
Nice.
And I looked at my physical therapist, and I said, I want her walking tomorrow.
Wow.
Meaning by tomorrow.
Yeah.
So then she said to my physical therapist, is Dr. Matt, she said, don't worry, dear. He puts pressure on all of us. Me putting pressure on her.
Yeah.
But she was walking the next day.
That's
right?
incredible.
And so at first everybody was laughing that I'm a bit hard, but then the next day everybody's like, you're a genius because I'm walking and I couldn't walk the day before. And what happens a lot of times is people forget that your nervous system controls the muscle fiber recruitment patterns. And when signals aren't getting, let's say, from the cortex, the opposite side of the body, as efficiently as they should, you're not going to be able to generate a lot of contractile force. So we figure out ways to use electrical stimulation and magnetic fields and light therapy and all these other tools to connect parts of the body so that now things generate more force. And then we give people the confidence of controlling their body by some of the brain mapping stuff that we do.
It's awesome.
Now, the reason why that's so important is time. See, the mistake that almost every cancer patient makes is something like this. They go, I was healthy my whole life, and then I had stage 4 cancer.
Right.
Well, that's totally not true. It took decades to get there for most people, maybe not a young child because they haven't been alive that long, but they had a disease process in their whole going on in their body, and simply because they never took the time to get a good, thorough checkup. They didn't know what was going on. So it's growing and growing in their body. Now they finally feel something, and they go, let me get a checkup. So they basically admit, I couldn't feel the cancer growing in my body. Because if they did, kill it at 5 cells, they'll let it get to 100 million or something, And so now they have all this cancer, and then what they say is, well, I feel fine. I don't feel any pain. And this is the time to take some action, because by the time there's a point we call, once you go over the waterfall, there's no turning back, right? It's too late. And unfortunately, most people wait until they feel pain or until they feel something wait a minute, why would you wait till the very end to take action? That's almost like guaranteeing you're going to die, right? That's just not the best way to approach things. And so we try to do is get as many different systems involved to help people, because as soon as we get someone stronger and as soon as we improve their metabolic efficiency, we give them more time. And then with that time, we can test different treatments to see if they actually work. So that's sort of the logic there. Many people go in for chemo, and they go to chemo killed my loved one, let's say, a family member that survives. What they totally ignore from that is, well, your family member was frail. They were so weak they couldn't stand up out of the chair, and they had malnutrition. So how are you going to say the chemo killed them when they couldn't stand before the chemo, and they had, they were low in almost every vitamin and mineral. Even without cancer, without chemo, you're probably going to die if everything is low, right? So, but there's a logic that's lost because everyone's so emotional about the loss of life,
Sure. So your approach is, okay, somebody comes in, all right, we need to get them stronger. We need to try to get their, nutrition better on par. And then once we kind of raise their baseline up, then we can start to explore different treatment options for the cancer itself. But it's first of all, before we even attack the cancer, we just need to get their body functioning better. Am I understanding that correctly?
I would say generally that's true. Now, let's say if someone comes in and they're already pretty healthy, there may not be that reason, I'm not going to start you at 0, right, if you're at 20. You know what I mean? I'm going to start you with some more appropriate level. But because most people wait too late, they're coming in pretty rough shape. These are people that do not have spinal cord injury, for example, or don't have serious arthritis, and they're in wheelchairs, right? So that means they're in a wheelchair because they lost so much muscle and there's such poor nutrition that they don't have the physical resources to stand. So they may not be able to handle, simple natural therapies because they're so below normal. And I put some examples. We've literally had people gain 20 to 40 pounds of muscle. I mean,
wow,
almost 100% muscle, and they were still skinny.
Wow.
Think about how below normal they were. It takes, you have to have a very strong vision. When someone comes in and you see their bones sticking out through their skin and the skin's hanging off them because they lost so much tissue. You got to really have a strong mindset and be very positive, because all they've seen in the mirror is their body is wasted away. So we have to, make sure that we can be that light to keep them going, so they get there. But it does open up, having a positive mindset, having the right family members around you. It's as sad as this may seem, I've seen a number of couples now where, let's say, the husband or wife is dealing with cancer, and their partner was not as, shall we say, supportive as it could be. And, when you have a disease like cancer, one, you have to have the freedom to make your own choice, right? Because if you don't believe in what you're doing, it just doesn't work. And then the family has to be willing to support that choice, or at least have, if it's really whacked out, I guess someone has to have enough sense to say, look, this isn't working. Let's look at another option here. And those are difficult conversations to have.
Sure, absolutely.
How do people find out about what you're doing? Because I would think, if you get diagnosed with cancer, that's really scary, and you're going to do, if I was put in that position, I'd be like, well, okay, whatever the doctor says, we got to kill this thing as soon as possible. And I think in the general populations, the slowest possible way to treat this could be with exercise and nutrition. It's like, hold on, I already went too far I already jumped off the cliff here. How do people find out about your therapy or your approach, I would say? Just because I would feel that the diagnosis of cancer would be so intense. It's like, okay, I'm just gonna do whatever, the traditional way. Let's get rid of it. Go. And your way, although maybe more effective and less killing of other things in the body, seems like maybe a slower process. Is that correct?
Well, so one, the way people find out about us, mostly, we have a really good marketing effort right now, but most people, it's still word of mouth. And part of it is that most people don't understand how to use the web the right way or use internet searching. So typically what happens is, let's say someone's diagnosed with cancer, they put in a diagnosis. So let's say it's a guy, prostate cancer, a woman, breast cancer, something like that. And they get somewhat educated that way. Then they may go treatment. So they have prostate cancer treatment.
Oh, sure.
And so what is lost in that is the way the algorithms and the artificial intelligence platforms are set up. It's to get pages that produce a better return on revenue for Google and Bing and whatever search engine you're using. It's not designed for optimal biology, right? It's not designed to make sure you get the best available for you. So you have companies competing for pay-per-clicks and getting their ads and stuff in front of you. You have all these different things that are totally lost. And so what's happening is people make decisions based off marketing, but they believe they're making it off science. And because they don't understand the difference, as science tells us, no two people respond exactly the same way. What do people ask about is treatment success rates. It doesn't matter if 100 people came in and we treated them all successfully and they all leave with no evidence of disease. The next person is all on their own, has nothing to do with the other 100.
That's a great point,
and that's the gap that most people don't see. And just some common sense stuff, like all these drugs that get approved, they were approved because they work in research. Now you go in real life and they don't work at all. So what's the gap there? And the gap is that in a controlled study, where they could illuminate outliers and manipulate things, you may be able to show something, but that's not a guarantee it will help the person that's suffering. So the way that we're sort of trying to reach out, one is when a patient comes here, we leverage the power of family and community. Everyone that comes in is working out. So we've just had a young woman here. We had her boyfriend and her mom working out. Her mom looked so good afterwards. People kept saying, is she the fitness director?
That's awesome.
She got in good shape. And then, we've got, every time we try to get the other family members involved in doing things, because you can't, let's say, come here and we're saying, hey, don't eat this junk food. And then you go home and your partner's eating a box of Twinkies in front of you while you're trying to, make adjustments. That's just not a good environment. So we're trying to get everybody going in the same direction, And then we leverage that when those people are here, they get involved in learning how these technologies affect their body and how it feels to be in a magnetic field, how to work out and stuff. So it's not only just education by sharing some information with them, but it's also education from a practical perspective where they feel how these energy systems affect their bodies. And then they go and tell their friends, and so there's that kind of word of mouth effect. And then we provide a lot of free content. We have a number of ebooks on the website that people can download for free, and we have all kinds of blogs. There's so much information coming out, but there's always there's a context. Every time something new comes out, say a company funds a study, now they have these results, they're going to push that out through all kinds of press release campaigns and strategies. So now all these people hear, wow, there's this new treatment for prostate cancer, let's say, or lung cancer, whatever the case may be. What they don't realize is that it may not be the best treatment for them. Maybe the best treatment for them would be something that was discovered 50 years ago.
Sure.
Right?
It's true.
Sure.
It's very true. So do you find that when people are exercising at your facility that not only are they getting stronger, but the exercise itself helps combat the cancer, helps to kind of move them from a disease state to more of a state of health?
Yeah, absolutely. So the thing is that there's two terms in cancer biology. One is immunosenescence, and the second is immunoevasion, that are particularly important with respect to exercise. Immunosenescence is kind of like a fancy way of saying the immune system is sleeping.
Okay.
So like if I got cancer in my body, how come my immune cells, my natural killer cells, my macrophages, all these guys that fight, cancer, how come they stop doing their job? And what almost everybody always says, oh, my immune system is weak, that's why I got cancer. It's actually not true. Well, at least it's not true for everyone. It may be true for some people, but not for everyone. Most people, when we measure these immune parameters in their blood and stuff, what we find is not that they had a low count of natural killer cells or their natural killer cells were not functional. We find they actually have a higher suppression, meaning they're specialized T cells called T suppressor cells, and somehow their immune system has higher levels of T suppressor cells holding their immune system back. And so in that strategy, if you try to boost the immune system, you're still boosting the suppression. So it's not a good strategy, and that's the reason why so many people had immunotherapy and got no results, because they're boosting the stuff they don't want to boost, and they never thought about it because no one measured it. The other thing, the other concept of immunoevasion, it speaks to how cancer cells may attach to platelets. Our cancer cells started as our own healthy cells, right, before they mutated and had damage. So there's a lot of our self in the cancer cells, so it's difficult. It's kind of like your one healthy cell sees this guy from this angle, he looks like a normal guy, but from this angle, he doesn't look like a normal guy. It's not so easy to find all these details out, and especially when a cancer cell can attach to other cells and kind of hide, a cloak, stuff like that. Exercise is a great tool to address that.
Okay.
But the way exercise needs to be administered, it has to be administered in a way where it addresses your weakest areas. So as an example, we'll have people come in with stage 4 cancer, like I've been doing yoga my whole life. Well, that's great, there's nothing wrong with yoga, but your body probably got to a point where it got the benefits from yoga, but what about all these other types of exercise?
Sure.
Yeah.
And the rule of thumb, if you were saying like, what's a way to fast track some of this? Generally speaking, a lot of women do yoga, so they're more flexible. A lot of guys lift weights, so they're not as flexible. So if you told, more women lift weights, more guys do yoga, you'd probably get better balance across the board.
Sure.
If there was some stereotypes, on an individual basis, you would just test each person and see where their weakest link of their fitness was and try to figure out a way how to address that.
Okay. Interesting, very interesting. So if somebody comes in and you're putting them through different kind of cardiovascular tests, strength tests, flexibility tests to see, and then are you measuring them against a standard norm to say, okay, well, for your age group or whatever, your strength is low or your flexibility is low, or are you just saying, okay, this is baseline where you're at, and we're going to start to try to progress all of these? How does that work?
So it depends on the context of the person and what the goal is. So if someone comes in that's in really bad shape, I don't have time, right? So as much as I would like to collect data as a scientist, I can't tell them, hey, stop dying on me and let me measure, right? That just won't work, right?
Yeah.
It's not practical. So we have to create what's called user-defined tests. And the user-defined test would be, if you can't stand up, there's tests, there's a sit to stand test, right? So you can measure how much you could stand or how many times you stand in a minute. So that might be an appropriate test for you. But if you're already running miles, I'm not going to waste your time doing a sit to stand
Sure,
test.
sure.
Right.
And I've had guys come in that look like track athletes. They were just very lean and chiseled, and they move really well. And they had, colon cancer that spread to their lungs and their brain. Like, you
Wow.
can't look at someone and basically guess the threat to their health. I've had other people that look terrible, and as far as how physically, like how things have affected their body, they have a tiny little tumor.
Interesting.
So this is the challenge sometimes, because now for each person that gets cancer, it's their first journey, right?
Sure.
So maybe their only journey, if you will. And so they're going by how they feel along this journey. And what they're ignoring is that, well, we have experience with 100,000 people now from all over the world. So you don't want to go by how you feel. Let's go by what is, how is all this data, how could it be utilized in a way to prevent you from suffering further? And that's where when people go by how they feel, they're missing opportunity to jump ahead,
Sure.
So it's like this, like, let's say you went to a restaurant and the food was terrible. And hey, Tom, that food was terrible. I wouldn't recommend going there. And I go, oh, I got to find out for myself.
Yeah.
So now I go to man, that food was terrible. You go, well, you could have saved some money, or you could have a better dining experience going somewhere else, right? But with cancer, people do this over and over again. We watch all these people try things that don't work. And then you say, well, we've got thousands of people that have tried it. It has never worked for any of them. Could it work for you? Yes, there's a small possibility it could. But let's focus on the stuff where thousands of people did something that actually did work.
Yeah.
You know what I mean? If we're going to make a choice, let's start with the stuff that's higher ranking instead of lower ranking,
Right.
Sure. So when people are coming to see you, let's say they're, battling cancer, are they only seeing you, or are they additionally seeing, you and the specialties at your facility, or are they also doing traditional route of treating cancer as well?
It depends. So normally I would see up to 8 people at a time. So this is not like, hundreds of patients everywhere and stuff like that. And the reason is we spend a lot of time with each and every case. We had a patient today we spent over 6 hours with,
Wow.
right? And it's because they need a lot of care. If someone says, look, I want to make sure I live and I don't want any excuses in the end, what I would tell them is, okay, let's look at the type of cancer you have. Let's run some tests. Let's do everything we can in a coordinated, integrated fashion. And it might mean full dose chemo, full dose radiation, and then all these other strategies that we create to complement that. I've had up to 10 people here at a time, a little bit more than normally I would want to handle, that were going to Mayo Clinic, Cleveland Clinic, MD Anderson, because their centers are located nearby, getting full dose chemotherapy and or radiation. Most of our patients have had, well, in that context, more of those people that were getting chemo, less were getting radiation, but some were getting both. And they were all doing extremely well. And so when they go back to, let's say, get chemo, the doc's like, wow, you haven't lost any hair, or your arms look bigger,
Sure, yeah.
because they have more muscle. And they look around and see all the other people, and they're looking rough. Their hair's falling out, they lost all this muscle mass. But unfortunately, no one says, hey, what else are you doing? What they say is, oh, that stuff's placebo.
Yeah.
Well, let me tell you what, I've done all kinds of supplements, tried all kinds of exercise training programs, and I wanted to get as big and as strong as any athlete in history. It takes effort to get bigger and stronger. You don't look at a bottle and grow, right? It's not that simple. So when doctors say stuff is a placebo, yeah, it's possible, but we're talking about someone who's dying from cancer, and they're praying, they're going to church, they're doing all these things, and things are going downhill. So it's probably not going to be a placebo in this context.
Sure.
So if anything's working, it's probably because it's really working, and not because they made it up in their head,
Right. No, definitely.
Yeah. So the patients that do come in, to answer your question, they're seeing, so generally speaking, if it's someone that needs a lot of research, sort of behind the scenes, I may see them a little bit, crack some jokes, make them laugh, put some positive energy, in their life, get them coordinated with the other, members here or professionals here. And I look at a lot of numbers. I look at a lot of lab values, and I connect a lot of dots. And then I go to the docs and I say, here's what I'm seeing. What do you see? And they might tell me, yeah, I see the same thing. And I might say, I'm a blind fool. They say something else, we have differences of opinion sometimes. And so what I look at it then is, all right, how do we make sure the patient gets the best of both worlds? So let's say, imagine if I'm seeing left and you're seeing right. How do we make sure that both bases are covered? It's a little more complicated sometimes, because my end game is a patient's healthier than ever and they live. And when you're dealing with so many unknowns and uncertainties, that's a difficult goal to have sometimes for some patients.
Yeah, for sure. So if any of our listeners right now either have cancer or know somebody that has cancer, okay, and we've talked about some things that you do in your clinic from an exercise perspective, or I talked about, hey, want to make sure that we are getting balance with their workouts, okay? If they're doing predominantly strength training, let's get them doing a little bit more flexibility training and vice versa, making sure that trying to connect their brain to all their muscles to make sure that they're able to use all their muscles and get greater force output and stuff. But if there's anything else that you would recommend that they're doing from an exercise perspective, like what would that be?
So there's I would have them look at their feet. There's a lot of interesting data about balance just from the proprioceptive awareness in the feet.
Interesting.
I would have them maybe look at movements where it's like controlled falling.
Okay.
Right? So, imagine you've never fallen in your life and now you slip. How do you know how to catch yourself and land? Right? You don't have any practice.
True.
And that's typically where, especially older people, they get caught off guard. Especially, I've worked with a lot of, guys who are track and field athletes or NFL athletes. So in their prime, they were studs. But now it's, it's maybe 40, 50 years later, they're older and more frail. They've never fallen in their life. They've taken a lot of hits and they were always strong and can handle it. And now all of a sudden they're in a situation where they fall, their bones aren't as strong, and they don't have as much muscle, and they don't know, I don't think anyone really knows what to do when they're falling, right? Unless you've practiced it. And so we have different programs where people work on, what to do if you're, how do you practice falling so that when it does happen, you know what to do with your body.
Okay.
Some things that can help a lot of people is rotational movements like a log roll.
Okay.
Or so like as kids, you ever remember like going on a hill and rolling down like a log down a hill?
Yeah.
Movements that challenge vestibular function. So that's like your inner ear controlling your brain, if you will, or feeding into your brain information. Even spinning around in a circle. Like you want to do this stuff in a controlled setting so it's safe, so you don't have to like fall or bump into something, hit your head. But by challenging the vestibular function, it helps kind of get things lined up better, better oriented. So now you have better sense of awareness with balance and things like that. Maybe look at your eyes to see which eye is more dominant than the other.
Yeah.
It's missed a lot of times. Let's just say I'm left eye dominant. When I'm under some sort of threat, and that threat is interpreted by my nervous system, it's not a conscious interpretation, I might shift my body so my left eye can see what the threat is.
Yeah.
So by doing that, it can be affecting the loading I put on my joints. And so there's some weird patterns we'll see sometimes, like someone's always hurt on their left side. And then you look and see, well, they got something, they always tend to put their left side first when they rotate and things like that. So that doesn't explain it for everyone, but it gives you some ideas.
Yeah.
Sometimes it's like left side of your body generally is controlled by the right cortex. So we might see that there's some communication issues with left cerebellum and right cortex. So these are things that can be worked on.
Yeah.
And then by increasing in body awareness, now you're in a better position to deal with stuff thrown at you.
Sure. Very cool. Very cool. Well, Dr. Tom, we're interested because we've talked a lot about kind of what you do in your practice and how you help others improve their health. We're curious, what do you do to improve your own health on a daily and weekly basis?
So, like I was saying, I'm pretty strong. Without much training, I could bench over 400 pounds pretty easily.
Wow.
The joke
That's
is
awesome.
I'll go into the gym and I'll be benching with the bar. And, people come and go, you wimp, it's just to make fun, And what I learned from very strong men, many years ago, strategies that they were doing when I was young at the time, I would watch these really strong guys lifting like lighter weights at different phases. And what they would tell me is, well, I don't need to kill myself. I just have to do something to stimulate adaptation going in the right direction.
Sure.
And when you get older, you're thinking longevity now. You're not
Yeah.
thinking, when you're younger, you think, I want results right now.
Mm-hmm.
But then when you get older and you have injuries,
Mm-hmm.
you think, how do I make sure I wake up tomorrow?
Right,
It's a
right.
different strategy. And so as I've gotten older and gotten injuries from competing for many years, now I'm thinking longevity, right? I'm
Mm-hmm.
not thinking about right now. So like today, as an example, I did isometric holds for 30 to 60 seconds
Nice.
at different joint angles on each leg.
Awesome.
And the reason why I started doing that is I just found that incredibly stimulating for strength and balance. So like, I don't know some of the CrossFit terms. I think like pistol is one where you
Okay,
kind of
sure.
like go down one leg and the other leg's forward.
Mm-hmm.
So imagine, instead of that, you're just going all the way down, you're stopping at a joint angle and holding it 30
Yeah.
to 60 seconds, come up and you got like a 10-second rest,
Mm-hmm.
and you go down to a deeper position or a different position. Then imagine now that front leg that's free, instead of going in front of you, now it's going behind you.
Mm-hmm.
Now it's going to the side of you. Or now as that goes, let's say sideways, it's almost like, it's kind of like combining yoga and CrossFit with some isometrics,
Yeah.
if you will.
Love that.
So the idea is trying to make sure that I've strengthened my joint from a variety of angles. It's just something different to do. So it breaks up the board of like instead of squatting or deadlifting all the
Sure.
time type of thing. And what's nice about a lot of this stuff is you don't need any equipment at all.
Mm-hmm.
If I have a wall, you
Mhm.
know what I mean, or a ground, I
Yeah.
can work out. And so it makes it a little bit easier. One of the other things I've been doing is a lot of extension work.
Okay.
So let's say there's a wall right behind me.
Mm-hmm.
You start out, I'm standing by the wall, and I might have one hand lightly touch, the other hand lightly touch, and I'm going up. And as I'm going up, I'm working on like a rotation. And the reason for touching walls, you need a tactile cue, like an end point for your fingertips or something. But as I get warmed up, what I'm eventually trying to do is like a standing back bridge.
Mm.
And the goal would be from a standing position to go all the way into a back bridge where your palms are on the ground, and then come back up.
Okay.
And then do it for reps.
Sure.
Very few adults can do that, right? Like you need a lot of mobility, flexibility, and strength and coordination to do that.
Yeah.
And I'm not even close to that right now, but I've improved dramatically.
That's awesome.
But it's funny, then what I'll do sometimes, so I took some TRX, I don't know what you call them, bands, straps.
Sure, straps,
whatever you
yeah.
wanna call them. Yeah, and I set them up so I could actually go into like a back bridge,
Mm-hmm.
but I got the support. Like, so in other words,
Okay.
so imagine I got it close. I go into a back bridge, and as I'm going down, I use my arm strength to lower me down.
Oh.
So my feet are on the ground. I'm going all the way down, and my head touches the floor,
Wow.
and I kind of pull myself back out of it.
That's awesome.
And then what I'll do is I'll take, I have magnetic fields that have different devices that stimulate muscles to contract. So I could, let's say, a simple example is if I want to strengthen the brain connection to my back muscles. I put these devices on my abs that are causing my abs to contract. So it's making me flex the spine,
Okay.
but I'm extending against it. So I want to make sure abs
yeah.
crazy sore.
Yeah. I bet.
Like ability for your brain to control your back gets way better.
Sure,
So I've
sure.
used this with people with spinal cord injury and people with just brain damage from like a car accident, head injuries, things like that. Or for example, not too long ago, I was just starting to get into doing some curls. And I was curling like 25 to 40 pound dumbbells, nothing that heavy. And then I tried something. I took these magnetic field machines, I put them on my biceps, and was using that to stimulate muscle fiber recruitment while I'm curling.
Oh, wow.
And then in like 2 workouts, I was doing 75 to 100 pounds.
Wow.
That's
We know
nuts.
now, we know how to use electricity and magnetism to get the brain to connect to muscle better.
Wow.
And what's really cool about this is that it works even when there's arthritis and dysfunction.
That's great.
So like normally if you have a bone spur, there's something called arthrogenic muscle inhibition. So the bone spurs and the cartilage or in a joint, they're basically inhibiting your nervous system. So it's hard to generate force when it's shutting down on you. Well, using electricity and magnetism, we can override it. And the significance of that is you have a healthy recruitment pattern. And then instead of recruiting in a way that aggravates the bone spur, you can recruit in a healthy way and help the tissue remodel so you eliminate the bone spur.
Interesting. Very neat. That's really neat.
Yeah,
Well,
so I use a lot of the resources we have, you
Yeah,
might say.
that's
That's
awesome.
great.
Very cool. Well, Dr. Tom, how can people find out more about you? How can they find out more about Causenta Wellness and possibly get in touch with you or your clinic to come in, and if they are in the Scottsdale area or are willing to travel in to, get seen by you?
So they just go to the website, causenta.com. That's Causenta. And there's actually a free form they could fill out. And then one of our, they could either schedule an appointment or somebody can contact them, depending on what they want to put in the notes. And then, the rest is kind of up to them.
Sure.
We try to start off, at least tell people, here's what we recommend you do. And then here's what we think it would cost. They kind of get some free insight, if you will. And then if people follow directions, it's a pretty good fit.
Yeah.
I'm not saying I'm old,
Okay.
but I've treated 4 generations of family members.
Wow.
So
That's amazing.
What I like to say is I have experience.
Sure. Yeah, exactly.
That's a better way to say it.
Exactly. All right, is your company on social media at all? Are you on social media for people to follow?
Yeah, so we have Facebook and LinkedIn and all that kind of stuff going
Nice.
on. I'm personally not on that stuff. Like I have teams that manage all that, just because I'm more focused on the individual in front
Sure.
of me, And then I do a lot of lecturing. I just came back from lecturing in Costa Rica
Wow.
at the World Ozone Without Borders Conference, where I shared some pretty exciting data with the medical professionals that were in attendance.
Very neat. Very neat. Well, Dr. Tom, the question that we like to wrap up with for all of our guests is, what is your definition of health?
Goodness gracious, man. Well, it's always evolving, because, what we used to say was the absence of disease, right, years ago. But we don't know everything yet. So let's just say we don't know what to measure, and how could you know you don't have it if we can't measure it?
Right.
What I would say is I embrace more of a fitness-oriented approach to health, and I would say it like I want to be able to do whatever I want, whenever I want, and I want to be able to eat whatever I want, whenever I want,
Yes.
and no penalties to either.
Yes,
Yeah.
exactly.
Yeah.
Exactly. I
So-
love that.
I want to live life on my terms. I don't want to have to live in fear
Yeah.
or worry about, if I ate something, am I going to get a problem later on in life?
Sure.
And the way I always addressed it is I'll eat whatever I want, but then I'll train really hard to compensate, so one way or another, I'm going to burn it off me.
There you go. There you go. Love that. No, I knew we can really vibe with that approach, because so many of the professionals that we talk with now are taking that approach to, or that mindset towards health, where health isn't just about the absence of disease, but it's about being able to live your best life, having your body working, like you've said, like optimum biology, as working as optimally as possible. And so that definitely vibes with what we do here, what we've spoken with other professionals, and definitely sounds like with what you do at Causenta as well. So awesome. I really appreciate you sharing all that with us, and sharing your expertise and your time. I mean, this was really, really cool.
No, thank you so much.
Thank you for the opportunity. You're both really good looking, by the way.
Appreciate that. Thank you. Thank you. For our listeners, who do you know that needs to hear this episode? Share this with them so they can learn about the work that Dr. Tom and his team at Causenta are doing. And while you're online, if you wouldn't mind, head on over to iTunes and leave us a rating and review. We always appreciate the feedback, and because it lets us know that you're listening, and that means a lot to us. It really does. Well, thanks so much for tuning in. We always appreciate it. Have a fantastic week, and we'll talk with you all next week.